Hello everyone, I have no financial disclosures. Posterior lenticonus is a congenital anomaly of lens characterized by a localized round oval well-circumscribed protrusion of posterior lens capsule and cortex. The presumed cause for development of cataracts is mechanical due to posterior bowing of the lens capsule and progressive degeneration of lens fibers. In 2008, Mist and Associates reported outcomes of posterior polar and posterior lenticonus cataracts in 32 eyes. More recently, in 2014, Lee and Associates reported 47 eyes of 43 patients with posterior lenticonus related cataracts. These studies, along with few older studies, reported prevalence of bilateral posterior lenticonus to be around 0 to 10%, and none reported the refractive outcomes. The aim of this study was to analyze the clinical profile of patients presenting with posterior lenticonus and their surgical, visual, refractive outcomes, and to identify the characteristic differences between unilateral and bilateral cases. The electronic medical records were retrospectively reviewed for the diagnosis of posterior lenticonus and posterior polar cataracts from January 2014 to December 2019. The surgical records of these patients were screened and the confirmed cases of posterior lenticonus were included in final analysis. We confirmed the diagnosis preoperatively either by slit lamp biomicroscopy or immersion B scan, or intraoperatively by noting a typical cone-shaped protrusion of the PC or sharply bordered PC defect with or without positive facial sign. The collected data, the collected demographic preoperative, intraoperative, and postoperative data was statistically analyzed. Coming to results, out of 2,110 non-traumatic cataracts which were operated, the prevalence of posterior lenticonus was around 4%. So 84 eyes of 63 patients were included in the final analysis. Contrary to the existing literature, we found much higher prevalence of bilateral lenticonus in about 1/3 of the cases. This gave us an opportunity to study and compare the profile of unilateral versus bilateral disease. About 40% of the patients had total cataract, and the most common presenting symptom was leukocoria. Patients with bilateral diseases were significantly younger and had a shorter and smaller eyes. Confirmation of diagnosis of posterior lenticonus preoperatively was possible in only 57 eyes. The sensitivity of immersion B scan to diagnose posterior lenticonus was only 47%. While 88% were pseudophakic, 12% were left aphakic. Out of this 10, 9 eyes were of bilateral cases. The pre-existing posterior capsular defect was present in 44% of the cases. The mean follow-up period was 1.3 years. The visual outcomes were similar and unilateral and bilateral cases, but there was significant difference in refractive outcomes. 2 cases had intraoperative complications needing IOL repositioning for optic capture and Pascana vitrectomy for cortex removal. Though the visual outcomes were similar in unilateral and bilateral cases, the age-wise trend showed that older the patient, the better were the visual outcomes. Also, patients more than 2 years of age had better visual outcomes. Overall, at 6 months post-operative period, around 48% patient had good to fair visual outcome. Only 2 cases had familial cataract. None of these patients in this large cohort had any systemic associations. 1 case each had DRS and microcornea as other ocular associations, while none had persistent fetal vasculature. Our study has few limitations. The genetic analysis in these cases of bilateral and familial posterior lenticonus could have been performed, but was not possible due to patient profile. UBM and ASOCT could help in preoperative diagnosis of posterior lenticonus, but again was deferred in most cases due to economic reasons. More than 1 operating surgeons were involved in treating these cases, and we were able to analyze the visual outcomes in 6 months in only 2/3 of the cases, as rest were either short of 6 months or lost to follow. To conclude, bilateral posterior lenticonus has a much higher prevalence than which has been described in literature, and the clinical profile of those with bilateral disease differs from that of unilateral disease. The diagnosis is not always clinical, and one must suspect posterior lenticonus in total cataracts. Cataract extraction with optical correction with IOL implantation is possible in majority of the patients. Despite the presence of pre-existing PC defects, intraoperative complications are rare. Visual outcomes are fair to poor, possibly due to late presentation and presence of dense refractory amblyopia. So this is the largest series of posterior lenticonus to date. It provides the prevalence of posterior lenticonus and analyzes the characteristic difference between unilateral and bilateral cases. It provides newer insights in terms of diagnostic, preoperative pickup rate, visual, and refractive outcomes. Thank you.
What was the age groups in which the studies were conducted? From which age to which age?
So the age group was, the range was 1 month to 13 years with a mean age of 4 years overall. And in unilateral cases, the mean age was 7 years. And in bilateral cases, the mean age was 4 years.
Any systemic abnormalities were detected in such cases?
No, in all these 63 cases, none of the patient had any systemic renal or metabolic association.
And the follow-up was done till what age? Post-operatively?
Post-operatively, again, the follow-up was done till the age of, like, it was, all patients were followed up, but the largest follow-up was 13 years. And but the mean.
No, after the surgery,
After the surgery, the patients were followed up for one post-operative 1 week, 1 month, and then 6 months. And all those patients who who completed the 6 months of follow-up were included to analyze their visual outcomes.
In your series, a few patients were left aphakic. What was the reason?
Because either they had smaller HCDs less than 10.5 mm or shorter axial length less than 16.5 mm. So these patients in primary setting were left aphakic, and 4 of them underwent secondary IOL in subsequent setting when they achieved the adequate ocular dimensions.